A new report released today is detailing the unsafe conditions inside the Louisville jail for both inmates and corrections officers. Investigators say if these needs aren't addressed, more people could die inside our jail. After a year-long investigation by the former FBI agent David Byer of Louisville, they found 10 of the 13 in-custody deaths since late 2021 could be linked to these 5 issues. Prior leadership allowed shortcomings. The facilities are woefully inadequate and outdated. There is not enough staff at the Louisville jail. Some of the corrections officers fail to adhere to basic security protocol. Lastly, the medical care program needs an overhaul. WHAS 11's Isaiah Kim Martinez has been digging into the report, which is more than 400 pages long. And Isaiah, I know you're going to talk about what this means for the current jail director coming up, but this was a big focus again, is the call for a brand new jail. After all, this thing was built to be the MSD offices.
Sure, Doug, that's been the common theme here, right? That the current facility just isn't built for proper inmate care or oversight. The report warns the city if specific changes aren't made, they risk more inmates dying, lawsuits, and the federal government potentially getting involved. An inadequate facility, poor supervision, lackluster training, and short staffing are largely to blame for deaths inside Louisville Metro Corrections. That's according to David Byer, the former FBI agent assigned by Metro Council to investigate the jail. Now, after numerous interviews and tours inside, he's determined prior city leadership allowed issues to fester, and it'll be up to the current administration to make big changes. That includes pursuing a new facility. In his findings, Byer shows photos inside Louisville's jail demonstrating how its design creates blind spots, preventing officers from having constant, direct oversight. The report also highlights the building lacks the space for medical and mental health services to be provided properly. Byer notes inmates saying mental health patients are housed with the general population and that it frequently takes 2 to 3 weeks to be seen by a medical professional. Metro Council President Marcus Winkler says funding for a new facility would be years away, but they could start coming up with a plan now.
I think when you look at that facility, it's probably past its functional life, and that we should begin work to look at what should a new and modern facility look like. And that includes things like mental health and substance abuse services. Start the process of looking at what is our capital strategy around a corrections facility.
Corrections Union President Daniel Johnson is calling for action right now.
If we don't get an updated facility, you're just putting a Band-Aid on a long-term problem. We've seen what the Department of Justice will come in and do, and we just don't want to wait until the same thing happens to us.
And the report also came with 22 recommendations. One of them is to create housing specifically for inmates with severe mental health challenges. Now, another is to separate violent from nonviolent offenders. Now, Doug, Byer made it clear in this case that these issues, many of them predate current jail director Jerry Collins, who started just last April. He does commend many of the efforts he's taken to help since then.
So they do believe that Collins is making progress in what must be an impossible situation, especially with the limitations with the building.
Absolutely, and ultimately it doesn't all fall on him.
All right, thank you, Isaiah.